Hey everyone, welcome back. It looks like a bunch of you have been asking for a deep dive into diabetic nephropathy, and well, we love to go deep.
Absolutely. It's definitely an important topic and one that we can, really sink our teeth into.
So we've got a really interesting case study to work with today. It's set up as a Q&A, which I always find helpful for, really breaking things down step by step.
Yeah, it makes it much easier to follow the thought process, right? Like you can really see how they arrived at the diagnosis and the treatment plan.
Exactly. So to set the stage, we've got this 46-year-old guy who thinks he's just going in for a routine checkup, standard diabetes management.
Yeah.
But then
Plot twist.
his blood pressure is a little high, 150 over 100. And there's protein in his urine. Not exactly routine anymore, huh?
Not quite. I mean, those two things together, in a patient with diabetes, that's kind of a red flag.
Yeah, this definitely points towards diabetic nephropathy.
Right. And it's a really common complication of diabetes, unfortunately. But the good news is, if we catch it early, like in this case, we can do a lot to manage it and prevent it from getting worse.
Okay, so just for anyone who's like nephropathy, what's that? Can we break that down real quick?
Sure. Basically, nephropathy means kidney damage. So diabetic nephropathy is kidney damage specifically caused by diabetes.
Gotcha. So this guy's kidneys aren't quite doing their job as well as they should.
Exactly.
All right, so let's dive into the management options they lay out in the case study. The first one is salt restriction. Seems pretty basic, right? Cut back on salt, lower your blood pressure, end of story.
Well, it's definitely a good starting point. Lowering blood pressure is always a good goal, especially when you have diabetic nephropathy.
But I guess the question is it enough on its own? Like, will simply cutting back on salt actually halt the progression of the disease?
That's where it gets a little more complicated. Salt restriction can definitely help manage blood pressure, but when it comes to actually protecting the kidneys from further damage, it's usually not enough.
So we need to bring in the big guns.
Exactly.
So that's where losartan comes in, right?
Yeah.
The case study highlights that as a key part of this guy's treatment plan.
Right, and for good reason.
Yeah, I'm curious to hear more about that. Like, what makes losartan so special in this scenario?
Well, losartan is a type of medication called an ARB, which stands for angiotensin II receptor blocker.
Okay, that's a mouthful.
It is. But basically, ARBs are really interesting because they do a lot more than just lower blood pressure. They actually target the underlying mechanisms that are causing the kidney damage in the first place.
Okay, so they're not just treating the symptom, they're actually getting to the root of the problem.
Yeah, you got it.
Nice. I'm always a fan of getting to the root of the problem.
Me too, absolutely. And with losartan specifically, it's been shown to be really effective at reducing protein leakage in the urine.
Ah, right. We talked about protein in the urine being a bad sign, didn't we?
Exactly. It's a key marker of kidney damage. And losartan helps to reduce that leakage, which basically means it's slowing down the progression of the disease.
That's amazing.
Yeah. And you know what's even more amazing?
What?
Studies show that using losartan can actually significantly reduce the risk of needing dialysis or a kidney transplant later down the road.
Wow, that is a big deal.
It is. It's a game changer for a lot of people with diabetic nephropathy.
All right, now I'm remembering the case study also talked about amlodipine, right? That's another blood pressure medication, isn't it?
It is, yeah. But it works a bit differently than losartan. Amlodipine is a calcium channel blocker. So it's great for lowering blood pressure, but it doesn't have those same kidney protective benefits that losartan does.
So, like, if losartan is the specialist, amlodipine is more of a general practitioner. Good for overall health, but not necessarily the go-to for this specific problem.
Yeah, that's a good way to think about it.
Love a good analogy. Okay, so we've covered medications, but I know there's also the dietary side of things. The case study mentioned protein restriction. Like, how does that fit into the whole picture?
Well, protein restriction can definitely play a role, especially when it comes to, reducing the workload on the kidneys, because when you have a lot of protein in your diet, your kidneys have to work harder to filter it out.
That makes sense.
So reducing protein intake can help to, lessen that burden and decrease the amount of protein that's spilling into the urine.
But I'm guessing it's not a magic bullet, right?
Yeah.
Like, it probably works best as part of a bigger plan.
You're absolutely right. It's not a solo solution. It's most effective when it's combined with medication, like losartan, and good blood pressure control.
So it's all about creating that supportive environment for those kidneys.
Exactly. It's like giving them a little extra help to do their job.
Love it. All right, so based on everything we've discussed, it seems pretty clear that, in this particular case, losartan is the way to go.
Right. Based on the information we have, it seems like the best choice for this patient.
But of course, every case is different, right?
Of course. Every patient is unique, and there might be other factors to consider.
Like what? What kind of things might make you reconsider the choice of medication?
Well, sometimes a person might have a pre-existing condition that makes using losartan risky. Or maybe they have an allergy to it. There could also be other medications they're taking that might interact with losartan in a negative way.
Right, right. So it's really important to work closely with your doctor.
Absolutely. They can take all of those individual factors into account and, come up with the best, most personalized plan for each patient.
It's a good reminder that, medicine is not one size fits all.
Nope, not at all.
All right, so we've talked a lot about the medical side of things, but I'm curious, from your perspective, what are some of the lifestyle changes that someone with diabetes can make to, really protect their kidneys from the start?
That's a great question, and honestly, prevention is key, right?
Yeah.
I mean, we always talk about treating the problem once it arises, but if we can prevent it in the first place, that's even better.
Right. So what can people do?
Well, first and foremost, good blood sugar control is absolutely essential. It's like the foundation of diabetes management. And then, the classics, diet, exercise, weight management.
Yeah, those always come up.
They do, but there's a reason for that, right? They're so important. Even moderate exercise can make a huge difference. And a balanced diet, low in processed foods and saturated fats can help protect not just your kidneys, but your overall health.
It's amazing how much impact those simple things can have.
It is. And don't forget about stress management, too. Chronic stress can really take a toll on the body, and the kidneys are no exception.
Yeah, stress is no joke.
So finding healthy ways to cope with stress, whether it's through mindfulness, exercise, spending time in nature, whatever works for you, it can make a huge difference.
Totally agree. All right, this has been a fantastic deep dive. We've learned so much about diabetic nephropathy, the different treatment options, and most importantly, the power of prevention.
It has been a great discussion.
So listeners, thanks for joining us. And remember, knowledge is power. Keep those curious questions coming.
Until next time.
See ya.